Singapore is offering its nurses up to 100,000 Singapore dollars spread out over 20 years to retain and attract talent. The Health Ministry hopes to boost manpower to meet the demands of an ageing population. Sherlyn Seah has more.
And give a warmest welcome to the Minister for Health, Mr. Ong Yi Tong.
An auditorium full of excited nurses as they welcome the Health Minister here to announce the new payouts. Mr. Ong even pausing at times during his speech, with applause roaring through the audience.
Don't clap so fast.
About 29,000 nurses stand to benefit from the scheme that starts in September. Starting with nurses aged below 46, the payout schedule will look something like this. They'll get between $20,000 and $30,000 every 4 to 6 years. Foreign nurses who've been in service for at least 4 years straight are also eligible. Meanwhile, for senior nurses aged 46 and up who have a shorter runway, they'll get a one-off payout of $5,000 to $15,000 if they've served at least 5 years. After which, they'll get the other payouts at an accelerated schedule at every 3rd year. The move comes on the back of a widespread manpower shortage in the healthcare sector, with especially high nurse attrition rates in recent years, fueled by the COVID-19 pandemic. 2021, for example, set a 5-year record high. In that year alone, over 7% of locals and nearly 15% of foreign nurses left the workforce. The nursing community welcomes the move. Beyond having a more stable workforce, retaining nurses also gives hospitals the chance to further upskill them and expand their capabilities.
We can develop the nurses to a more advanced level in terms of their provision of care. So it's no longer in the old days whereby we just take orders from the doctors. We are also looking at transforming care whereby we do initial assessment, and from our initial assessment we then develop interventions for our patient to intervene at an early stage so that the patient gets timely and effective care.
Beyond nurses, Mr. Ong assures others in the healthcare sector that they too will get similar support.
We will not forget you. We set up this scheme because nursing is the largest healthcare profession in our system. And competition for nursing recruitment has become more intense. But please be assured, if you are not a nurse, we will review the competitiveness of all your professions, with all the professions within healthcare, and make necessary adjustments to the remuneration package wherever necessary.
Meanwhile, the government is also looking at other ways to improve the healthcare sector. It's boosting training and stepping up policies against abuse and harassment of healthcare workers.